Welcome to the Abu Dhabi Korea Healthcare Week, hosted by KITA and ADCCI. The healthcare sector is a burgeoning sector amidst COVID-19, and the Healthcare Week aims to be a platform for Korea and Abu Dhabi. From Korea, we have Mr. Seung, the Director of Gangnam Public Health Center, and Dr. Jae-Hyung, CEO of SolGent. From Abu Dhabi, we have Mrs. Emily Hill, the Senior VP of Mubadala Healthcare, and Dr. Salam Mawar, CMO of SEHA, Mr. Neil Park, the Acting Director of Healthcare Planning Center of the DOH in Quebec. We're providing English simultaneous interpretation, and if you leave your question on the YouTube live channel, we'll collect them and present the questions to the speakers at the end. And now I'd like to invite the organizers for their welcome remarks. First, we'll have Mr. Abdullah Gola Al-Koibaisi, Deputy Director General of ADCCI.
Ladies and gentlemen, from Abu Dhabi Chamber, welcome to the Abu Dhabi Korea Healthcare Week online event, the most prominent event for healthcare professionals and providers in the region. We at the Abu Dhabi Chamber are proud to this event over 4 days. We will present the most promising investment opportunities in the healthcare sector in Abu Dhabi through the participation of Mubadala Healthcare, SEHA, and Department of Health Abu Dhabi, along with providing our members the opportunity to meet online with the leading Korean suppliers of the latest technology and products in the medical field. The prestigious event will offer many opportunities between the two sides. The Abu Dhabi Korea Healthcare Week aligns with the 40th anniversary of robust diplomatic ties between the UAE and Korea. This cooperation and partnership between the two countries expand, includes energy, retail, wholesale, logistics, construction, properties, and ports management, among others. This week, we complement our distinguished relation with the addition of the healthcare sector, considering it one of the most important and fastest growing sector in the UAE. We in the UAE feel proud that in 2019, our country made it to the first place in the 7 World Healthcare Index, according to the UAE Federal Statistics Authority. This reflects on our major activity this sector made during the current challenge, accordingly to be complete urgent healthcare matters. The most important is the loyalty and the professionalism in dealing with the novel COVID-19 pandemic. The UAE was able to surpass many advanced healthcare methods in dealing with the virus, thanks to the unlimited support of our wise leadership that worked hard and prepared and compelling investment environment, attracting the largest multinational companies, especially those operating in the healthcare sector, to build one of the world's most advanced healthcare systems. In conclusion, I extend my appreciation for all those who are wishing them all the best in achieving their mutual objectives. Thank you and stay safe.
Now I'd like to invite Vice President Haki-jo for International Affairs of KITA for his remarks.
네, 한-UAE 헬스케어 위크를 계기로 여러분들께 인사드릴 수 있게 되어 반갑습니다. 저는 한국무역협회 국제사업본부장 조학희입니다. 오늘 동시통역이 진행 중이긴 하지만 저희 무역협회 협력 파트너인 아부다비 상위 관계자와 또 아부다비 측의 참석자를 고려해서 영어로
We are providing simultaneous interpretation, but I will be providing the speech in English.
Vice President for International Affairs at Korea International Trade Association. It's a pleasure to host the Abu Dhabi Korea Healthcare Week with the Abu Dhabi Chamber of Commerce and Industry and the Gangnam-gu Office. I'd like to thank Mr. Abdullah Korea Al-Kubaishi, Deputy Director General of ADCCI, and Mr. Juno An, 안준호 부구청장님, Vice Mayor of Gangnam-gu Office, and the other distinguished guests for being here with us today. Also, I'd like to welcome all the UAE and the Korean participants on and offline. The United Arab Emirates laid down a clear vision for its healthcare sector. The UAE government announced the World-Class Healthcare Initiative, one of the 6 UAE Vision 2021 national agenda. Mubadala Healthcare, a state-owned investment company, is committed to increasing the number of healthcare facilities and developing high-quality healthcare services. Mubadala's dedication is befitting of a market that is expected to grow 5.3% annually. Today's webinar is a chance for 2 promising countries to meet as partners. SolGent, exporter of COVID-19 test kit to UAE, is here today. Also, the Department of Health of Abu Dhabi, Mubadala Healthcare, and the SEHA, the backbone of UAE healthcare policy, joined us. I look forward to the key outcomes of today's conversation with these active participants in the Korea and UAE healthcare sector. My association, KIRA, is also committed to playing its role as a partner organization. In 2018, we signed an MOU with ADCCI and affirmed both parties' dedication to mutual cooperation. Last year, the Gangnam-gu Office and KIRA co-hosted the 2019 Gangnam Premium and Merry Beauty Fair to widen bilateral exchange in the healthcare sector. With the past projects as stepping stones, KIRA will continue to seek ways to boost Korea-UAE cooperation. As we all know, we are suffering from the devastating global pandemic in 2020. But 2020 also marks the 40th anniversary of the establishment of Korea-UAE diplomatic relations. UAE's vision of world-class healthcare is indeed a timely agenda. Now, I'm confident that K-Healthcare is a suitable answer to this initiative. I hope today's event proves to be meaningful for you and the Korean participants. Thank you. 감사합니다.
안준호 부구청장님의
Now I'd
인사말씀.
like to invite Mr. Junho An, Vice Mayor of Gangnam District, for his remarks.
I am An Junho, Vice Mayor of Gangnam-gu District Office in Seoul Metropolitan Government. It's a great pleasure to join this event and give my remarks to all participants. Especially, I would like to give my special thanks to Mr. Abdullah Al-Kubaishi, Abu Dhabi Chamber Deputy Director General. Before coming to my position, I was in charge of Tourism Bureau of Seoul Metropolitan Government. At that time, at that position, 2017, 3 years ago, I had an opportunity to visit Abu Dhabi. At that time, I was deeply impressed with the rapid economic progress and sustainable development of Abu Dhabi. Fortunately, I was positioned to new position, Gangnam-gu Vice Mayor, and Gangnam-gu Abu Dhabi made an agreement of MOU to exchange between 2 cities this past September. I'm highly confident that this event will be the momentum to vitalize the relationship between 2 cities and between 2 countries. After overcoming the coronavirus pandemic, I am looking forward to see all of you in Korea, and I will definitely visit to Abu Dhabi again. Thank you very much.
Now I would like to invite our first presenter. The first presenter is on bilateral relations between Abu Dhabi and Korea Healthcare in Gangnam District, Korea, by Director Seung of Gangnam Public Health Center.
안녕하십니까.
Good
강남구
morning. I am the Director Seung of Gangnam Public Health Center. I would like to thank ADCCI, Department of Health of Abu Dhabi, and other participants for their interest in Korea's COVID-19 response. The Public Health Center is the center of K-quarantine. Currently, we have implemented the 3T model, test, trace, treat, and we are at the forefront of the response efforts. The first step, testing, is to find the confirmed cases early on and preventing local outbreaks before they spread. Gangnam-gu Public Health District separated the testing into 2 tracks at the airport, so cases within the country and outside. That is because Gangnam District is the busiest district in Seoul, with Koreans studying abroad and foreigners returning to this area. Therefore, stopping local cluster is the key. Our public health center transports inbound travelers from the airport to designated screening centers using airport limousines and then to their residence. So in total, 15,000 have been tested and went through a strict follow-up procedure. Second step is tracing, where we retrace the step of the patients. Using ICT, we trace cell phone GPS data, credit card records, and CCTV footage to track down the patient's footsteps and where they visited. For faster and more accurate tracing, we also introduced QR check-in policy in multi-use facilities, such as restaurants. 5 years ago, with the MERS outbreak in 2015, we revised the Infection Disease Control and Prevention Act, which allows us to collect data of hundreds of thousands safely and quickly. The last step, treatment and isolation, was a customized approach based on the patient's symptoms. Patients with mild COVID symptoms were housed in residential treatment center, and severe cases were admitted to hospitals specialized in infectious disease. Medical personnel, hospital beds, and PPE are limited resources and must be managed appropriately. So we prioritized the patients who needed to be admitted to the hospital for treatment. The Korean government plans to share the 3T model and make them international standard, strengthening cooperation with the international community. Representatives from Gangnam District, ADCCI, I hope that this is an opportunity for us to work closely together to defeat COVID-19. And now I'd like to invite Director of Tourism Promotion Division for Korea UAE Healthcare Sector Cooperation. Good morning. I'd like to present on the status of medical cooperation between Korea and the UAE. In the Middle East region, I'd like to take over a look of the market. Recently, the Middle East is looking to diversify its industry and develop new industry. So therefore, medical, pharma, IT, renewable energy, finance, service, that is where they're focusing. The medical device market is currently increasing, and by 2025, the total expenditure of Middle East will amount to $60 billion. Next, I would like to cover the collaborative projects into the Middle East market. 2019, we hosted Gangnam Premium Medi Beauty Fair in Dubai. In particular, we can take a look at the B2C meeting where a total of 326 participants joined us and 221 consultations took place. If we look at the number of consultations, so from Seoul National University Hospital, we had 25 cases, Jae-Hyung Oriental Hospital, 37, and then Cha University Medical Center for Treatment and Fertility Stem Cells, 74, plastic surgery, we had 60, and then Urology Hospital, we had 20 cases in total, which allowed us to see a profit of $236,000. Other than the fair itself, during the expo we had virtual plastic surgery simulator, media interview, and inspected the local businesses and other programs to boost the medical exchange between the two countries. Next, I'd like to cover the Korea-UAE Medical Center Business Cooperation. In 2014 September, Seoul St. Mary's Hospital and BPS signed an MOU, which allowed us to construct MENA healthcare with a Korean model checkup system. Thanks to this MOU, the Seoul St. Mary Hospital was able to provide construction, support, equipment, HR, and consultation, and they're actually in charge of running the MENA Healthcare Center. And in 2015 May, the Ministry of Healthcare and Welfare of Korea and Sharjah Health Authority of UAE signed an MOU to provide training programs regarding health insurance. And in 2009 August, Seoul National University Hospital and Sheikh Khalifa Specialist Hospital, they extended the co-assignment of cooperation for the next 5 years. So Seoul National University can provide diverse medical services, and Sheikh Khalifa Hospital will be hiring 1,420 doctors, Korean doctors, which amounts to 20% of the total HR, and provide 1 trillion Korean won as support. So these are some of the examples of how Korean hospitals and UAE are working together to boost the medical health care. And other than that, we're also, Korea and Dubai Department of Health signed an MOU and provided briefing to local medical personnel and supplementary training in 2019 January. Furthermore, this January at Abu Dhabi Sheikh Chakrabout Medical City, we hosted a seminar on Korean Oriental medicine. Next, I'd like to share a short clip that came from Jae-Hyung Oriental Hospital that covers the knee treatment.
الأوستيوارثرايتس وهو مرض يصيب المفاصل في الجسم، وكان المفصل الأكثر تؤثرا لدي المفصل الركبة اليسرى والكتف الأيسر. عانيت لفترة طويلة لعدة أشهر، 7 أو 8 أشهر، أعاني من الألم الشديد، ولكوني لا أستطيع أن أتناول أي مسكن من المسكنات لأن لدي حساسية شديدة لجميع المسكنات من نوع المسكنات مضادات الالتهاب غير استيرويدي، فكنت غالبا ما ألجأ إلى تناول مخدر مثل الترامادول لإزالة الألم. خلال الفترة الماضية 3 أشهر الماضية بدأت أبحث عن طريق الإنترنت عن أفضل المراكز بالعالم لمعالجة أمراض المفاصل، فاهتديت إلى هذا المركز وهو مستشفى جاسينغ لمعالجة الأمراض العمود الفقري وأمراض المفاصل دون تدخل جراحي. حالتي الصحية عندما أتيت كنت على عكاز، عندما أتيت من المملكة كنت على عكاز ولا أستطيع المشي ولا ثني المفصل ولا تحريك مفصل الكتف، وقد تماثلت للشفاء ولله الحمد، وشعرت بتحسن منذ الجلسة الثانية أو الجلسة الثالثة، فزالت الآلام تماما تقريبا في مفصل الكتف من الجلسة الثانية أو الثالثة. ولكن ولله الحمد بعد الجلسات الآن لي ما يقارب 3 أسابيع من الجلسات العلاجية، الآن استغنيت عن العكاز منذ الجلسة الثانية تقريبا، وأمشي ولله الحمد الآن بصورة طبيعية، وأحرك مفصل الكتف بصورة طبيعية تماما، وكان لدي محدودية في حركة المفصل سواء في الركبة أو في مفصل الكتف، وقد تحسنت باستمرار مع العلاج الطبيعي، ولله الحمد الآن أنا أشعر أني قريب من الطبيعي. بالنسبة للعلاج التقليدي الكوري في نظري يضاهي العلاج الغربي أو قد يتفوق عليه في بعض الأمور، لأن الألم الذي كنت أعاني منه في المفصل لا يزول حتى بالمسكنات، ولكن عندما بدأت جلسات الوخز بالإبر والحقن داخل المفصل زالت الآلام منذ الجلسة الثانية. فالعلاج الكوري علاج متكامل، والوسائل العلاجية تؤازر بعضها بعض للحصول على الشفاء بإذن الله. والله أنا أنصح جميع المرضى العرب وبالذات المصابين بأمراض في العمود الفقري أو في أمراض في المفاصل، وبالذات الذين قرر لهم إجراء تدخل جراحي ولم تجدي معهم بقية الوسائل العلاجية، أنصحهم بالتواصل والحضور إلى المستشفى وأخذ العلاج في مستشفى جاسنج. أنصحهم بتأخير هذا القرار، قرار التدخل الجراحي، لأن المستشفى هنا مركز جاسنج يعالج جميع الأمراض المتعلقة بالعمود الفقري والانزلاقات الغضروفية وأمراض المفاصل، يعالجها دون تدخل جراحي، والنتائج بإذن الله مضمونة. نتائج جميع المرضى الذين زاروا المستشفى تحسنوا وحالتهم أصبحت قريبة من الطبيعي أو الطبيعية.
앞으로 한국과
Like you saw in the video, I hope that we can create a new way, can continue to work together and exchange insight in the realm of Korean Oriental medicine. And I'd also like to cover how UAE DOH and UAE Army signed a MOU with Korean hospitals regarding sending patients overseas. So civilians can 10 cooperative medical centers can host civilians and 12 can host UAE soldiers. Furthermore, UAE is providing halal food program for dietitians and chefs in hospitals. I hope that Korea and UAE will continuously seek bilateral cooperation in the realms of healthcare facilities, the Department of Health, and UAE Army. And I hope that in the future, we can continue to contribute to boosting the healthcare sector of our two countries. Thank you.
시작해도 될 것 같은데. 네, 그럼 시작하도록 하겠습니다.
So now we'll begin.
먼저 한국 UAE
At the outset, I'd like to
진단을 대표해서
congratulate the opening of the Korea UAE Healthcare Week, and I'm very honored to have this opportunity to introduce SolGent at this Healthcare Week. I am CEO of SolGent, and I'm Jae-Hyung. SolGent stands for Solution for Genetic Technology, and it's a representative company for molecular diagnostics and genome analysis. Today, through my presentation, I'd like to talk about what SolGent is doing in terms of COVID-19 test kits and share our successful export cases in the Middle East market. So that'll be the order of my presentation. SolGent was founded in 2000, and it has a 20-year-old history. It's located in Korea's representative research city, Daejeon, and SolGent has a prime approval technology which allows us to analyze the genome. So we have our own in-house technology to analyze this. So we can do molecular diagnostics, genome analysis, and protein analysis. So these are the businesses that we run. And representatively, the molecular diagnostics allows us to track microorganisms, pathogenic viruses. And when it comes to virus, we have history of detecting MERS, as well as the well-known COVID-19. We have the COVID-19 test kit as well. The genome analysis means sequencing of DNA and RNA, and we can check whether there is an abnormality in terms of the disease. So these are the products that we sell. So we can detect cancer, and we have biomarkers that can detect cancer and other diseases. And also in Korea, we provide services for agriculture and livestock. This year particularly, we came up with something called pet genome, which allows you to detect the genes of your pets. So we have about 50 or so test kits, and we are exporting them around the world. And from now on, let me talk about the COVID-19 detection kit of SolGent. So SolGent first heard about the unknown virus from our Chinese partner end of last year, and they told us, they requested us to come up with a diagnostic kit. So we initiated development of this diagnostic kit in January, and we acquired approval from Korea and Europe in February, and now we're exporting them around the world.
솔젠트의 다이아플렉스 Q라고 불리우는
SolGent's Diaplex Q is the novel coronavirus detection kit. One box can do up to 100 diagnostics, and it's called multi-Q one step, and it allows us to amplify the genes and also detect the target genes at the same time. The detection kit allows us to especially detect ORF1A gene and N gene.
저희 제품을 사용하게
So
되면
if you use our product, you can select and detect the genes within 1 hour and 45 minutes after you take the specimen.
솔젠트의 코비드-19 제품은 한국의
SolGent's
수출
COVID-19 test kit, as I mentioned before, got approval from Korea and other countries. We got CIIBD approval from Europe, the FDA EUA from Canada, and also from US FDA, and we got approval from many other countries. Thanks to such approval, PEMA of US, for the first time in the world, allowed us to sell our product in the US, and at the moment we are supplying our products to more than 55 countries so that it can detect up to tens of millions of people. Among these regions, especially Middle East, Saudi Arabia, UAE, Georgia, Kuwait, Turkey, Iraq, and Israel,
미들리스트 지역에
are various Middle Eastern countries that we export to. Especially on the left side, you can see our success story. We have exported already 1 million test kits to Saudi Arabia. Recently, we have worked with UAE and Dubai, and by the end of this year, we will sell up to 55 million diagnostics kits. And ever since week, we've been producing them and selling them and supplying them. The Middle East, as well as other countries, are recognizing our product. It was thanks to the K-Bio and K-Diagnostics technology. But at the same time, all these countries around the world authorized our product. That's, the history of us selling various different products in other countries allowed us to get those approval. Especially SolGent is the only company to produce the raw materials in-house out of the companies that acquired the emergency use approval. And these core raw materials, we produce them in-house, as I mentioned before. And by doing so, we can expand the production volume
차별성을 가지고 있습니다.
in a very flexible manner.
초기에는 약 40만.
So in the early days, per week, we produced about 40,000. Now it's about 200 to 300 test kits per week. Especially Samsung Electronics and the Korean government's help allowed us to build a smart factory. The smart factory automated a lot of our manual work of creating molecular diagnostics kit. So, raw materials, packaging, creating, dispensing, all of this are automated and allows us to smartly manage our production process. By doing so, we were able to increase productivity and efficiency. And now we are efficiently manufacturing our product. At the moment, per week, we can and we are producing 4 million test kits. And if we finish the second factory, we can produce up to 100 million test kits. The smart factory, thanks to Samsung Electronics and the Korean government, Minister of SMEs and Startups, supported us to build the smart factory. So at the moment, we are focusing on COVID-19 products, but going forward, we will produce other molecular diagnostics products thanks to this efficient smart factory.
솔젠트는 그동안 자체 원재료를 직접 생산하는.
Up until today, as I mentioned, we have the efficiency of supplying raw materials on our own in-house. And we'd like to suggest this business to you.
원하는 OEM, ODM,
This allows us to provide OEM, ODM products that the buyers want, and the core raw materials we can supply to each country so that you may take use of these raw materials to come up with your own product in your country and get approval. That's one strategy that I'd like to explain. And SolGent not only focused on supplying raw materials, but also manufacturing other plastic or tubes. If you look at our smart factory, each process, each step, you can see that we have automated from label inspection, label attaching and capping to packaging, but also managing the raw materials and distributing the raw materials are all automated at SolGent. So also at UAE, if you use SolGent diagnostics products, if you want to produce it from your local region, we can supply the raw materials and also share the smart factory process know-how so that you don't have to import the product from us, from Korea, but you can create it. You can actually manufacture it from the Middle Eastern region, from your own country. That's the business that we would like to support. This support mechanism that I've just talked about has various different steps. All the tubes, the labeling and dispensing can take place in Korea, and then we can provide it to you, or we just supply the raw materials to you and you manufacture however the way you want. There are two different ways to do this. So in conclusion, I shared how SolGent used our core competencies to come up with COVID-19 test kits and also acquired approvals from more than 55 countries and are exporting them right now. And based on such history, we'd like to give more support based on the success that we've already gained from the Middle Eastern regions. And we'd like to now make inroads to individual countries in the Middle Eastern region. We have, the world-renowned class technology and materials and products, and we're ready with these products. So hopefully many partners, many buyers from UAE take interest in our product. Thank you. Thank you.
Thank you for a wonderful presentation. Next, I would like to invite Mrs. Emily Hill, Senior Vice President of Mubadala Healthcare, about Abu Dhabi Healthcare Investments.
Hello, good morning. This is Emily. Did you want me to project the slides myself, or will these come up? Good morning, everyone. Apologies for the delay, and thank you very much for hosting us. As you've heard, Abu Dhabi has made tremendous progress over the last 15 years in developing an accessible, high quality, and advanced healthcare system for the patients of Abu Dhabi, the UAE, and the region. And Mubadala Healthcare is very proud to be a contributor to this effort. You may know Mubadala as a global investment company with operations all over the world, with over $230 billion of assets under management. But when it comes to healthcare, our focus has been primarily in Abu Dhabi, and our future focus is to grow our efforts regionally here in the UAE with our vision to transform regional healthcare and the landscape. Mubadala Healthcare has three core pillars that it operates to contribute towards developing healthcare here in Abu Dhabi and the region. The main core pillar, which I'll focus on today, is our investments in healthcare provision. We also have, in the last few years, recently started doing global investments in healthcare in many different areas across Mubadala corporates. And our healthcare division is focused on growth equity investing in areas that are troublesome to the UAE, like many other areas of the world, such as heart and vascular disease, cancer, and diabetes and obesity. And our third area of focus is research, innovation, and education. So not only are we hoping to contribute to the economy, but we're also very focused on social development and sustainability of the sector. With regards to our provision network, we have 7 key assets. The flagship asset within Mubadala's network is the Cleveland Clinic Abu Dhabi. This is a 364-bed hospital that offers quaternary and tertiary care, very complex care for the sickest of the sick patients. Our average case mix index for Cleveland Clinic Abu Dhabi is 2.5, so well above what you see even in Cleveland Clinic, Ohio. And during the COVID-19 pandemic, Cleveland Clinic Abu Dhabi played a crucial role in partnering with SEHA and the rest of the healthcare provider system to offer care. In particular, our ECMO services were the main contributor to the very sick patients here in the UAE. Moving on, we have the Imperial College of London Diabetes Center, which has been our longest partnership and is a very specialized center that offers a full suite of services for diabetics here in the region. HealthPoint Hospital is a specialized musculoskeletal and sports medicine hospital with a very long-standing partnership with Wardle Hospital, offering our spine services from Korea. And this is an area of pride for us that has really served many patients and has made us a market leader through this partnership. We also have a very comprehensive reference lab, the National Reference Lab, which is a partnership with LabCorp out of the United States, which has the most advanced testing laboratory services and a very wide, extensive menu of local services here to serve the region. We also offer health screening and visa screening services, and we were an early investor in telemedicine. The Abu Dhabi Telemedicine Center opened in 2014 and has been offering telemedicine services to the patients of Abu Dhabi, which has been very important in the last year during our COVID-19 response. And finally, the newest member of our network is MENA Healthcare, which is a specialized rehabilitation and long-term care provider, which has offered very important services to both pediatric and adult patients here in the UAE. So in terms of healthcare provision, our assets feature distinct specialization, and that's how we started, really looking at specialized healthcare services. You can see that Cleveland Clinic's key areas of focus are our Heart and Vascular Institute, the cardiac services, neurology, oncology, respiratory critical care, digestive disease, ophthalmology, and most recently transplant, with the first and only multi-organ transplant being conducted at the Cleveland Clinic, and many other firsts that we've celebrated. HealthPoint Hospital focuses on bariatrics, complex dental, musculoskeletal, and spine services, as I mentioned, through Wardle Spine. Amana Healthcare, as I said, is post-acute care and long-term care. We have diabetes through Imperial, and the empty box here, as we look at where we're planning to grow in the future, is one, we're interested to deepen our subspecialty services within these core centers of excellence and really build a comprehensive offering for patients to improve patient care and experience. Additionally, we're looking to add our primary care services and shift our focus to really looking at how to prevent and complement the Abu Dhabi healthcare system through primary care and areas that are still in need, such as mental health. Research, innovation, and education is also a very critical component to what we do. Some of our accomplishments, we have over 500 articles that have been published in peer-reviewed journals by our very talented caregivers. Within our network, we have over 100 professors who are very passionate and dedicated to teaching. And we've started to really try to develop a long-term view of investing in developing Emirati talent to support the sustainability of the local healthcare sector here in Abu Dhabi. Here are just a few highlights of some of our innovation activities. At Imperial College of London, we have been studying genetic mutations of the monogenetic diabetes disease here in the Middle East to try to understand the key drivers and potential causes of the presentation. And we've had many other genomic related diabetes studies put forth from the Imperial College London Diabetes Center. Another example is with CCAD and the robotic surgeries that we're capable of doing. One, as an example, is a fully robotic bariatric revision operation, which was the first of its kind here in the UAE. So I think it's important to note that while we've made tremendous progress in the UAE and Abu Dhabi in particular, Abu Dhabi is not unique in the challenges that it faces related to healthcare. It's the same challenges that all mature economies are seeing, such as the increase of chronic disease, the increase of an aging population, and the increase of healthcare costs. But we firmly believe that Abu Dhabi is quite unique in its potential to address some of these challenges in several ways. One reason is because Abu Dhabi is not burdened by a legacy system and antiquated practices. And so there's an ability to really be nimble and dynamic in addressing problems. Abu Dhabi has very visionary, ambitious, and supportive leadership that can make things happen that you would not see in other mature markets. Abu Dhabi is also graced with having the most mature and dynamic regulator in the region for the GCC and MENA with the Department of Health. And it's a pleasure to work with them and help drive progress for the sector. And finally, I would say another reason why we believe many of the healthcare challenges can be addressed here in Abu Dhabi is because there's a very young and open population. The prevalence of mobile phones, people have 1 to 2 mobile phones. There's an openness to innovation and acceptance of digital tools, and this is a wonderful ecosystem to trial some of the digital technologies that are coming through for healthcare. So finally, Mubadala Healthcare, like everyone else, experienced many challenges during the pandemic, and we were very proud to stand shoulder to shoulder with our colleagues at SEHA, the Department of Health, and the private sector in Abu Dhabi to respond to some of these challenges. A huge silver lining of the pandemic has been the accelerated pace of change, where we've really seen a transformation in the model of care. And our hope is to continue and propel this momentum in a positive and continuous way. So for us, while we did have telemedicine established in 2014, we did experience challenges. There were lower adoption rates, and we were able to prove the value of telemedicine through gatekeeping models that demonstrated value to both patients and payers. But we really saw the uptick in adoption and the value of the services take off exponentially during the crisis this year with COVID-19. And so our current focus is really to continue the delivery of these telehealth services. We've seen an explosion of delivery for medication and pharmacy for all providers, including ourselves. We have increased our number of home care programs, our chronic disease management programs, remote care monitoring programs. So all in all, I would say our transformation has really begun, and we believe that we should be focusing on prevention and data aggregation today. And for tomorrow, we look forward to really moving the needle and accelerating the adoption of digital health to bring value to patients, improve their patient care journeys through the use of digital health tools. We'd like to see and introduce a hospital at home concept and create more spokes within the community and the region to drive medical tourism into Abu Dhabi and into our core assets here. So in summary, Mubadala Healthcare is very excited for the future and the outlook of healthcare in Abu Dhabi and the region. And we're very open to collaborations that help solve a few key problems. One, we are always continuously committed to improving patient care, making it more convenient, and making the experience digital and have the opportunity to have care anywhere. So we're looking for solutions to do this. We're also looking for solutions to really ensure the sustainability of all of our operations by either decreasing complexity or time for our caregivers and our patients within our assets here in Abu Dhabi. So I think in summary, that's a snapshot of Mubadala Healthcare. Thank you very much.
네, 감사합니다. 다음은 세하.
Thank you. Next up, we have SEHA, Dr. Anwar Wadi Salam, the CMO of SEHA Corporate, who will be introducing the SEHA services and its role in supporting the healthcare field in Abu Dhabi.
I would like to, first of all, thank the organizers for giving us the opportunity to participate in this conference. I would like in the next few minutes to give a bird's eye view on Abu Dhabi Healthcare Company, which is the short name for it is SEHA. It is the largest, most comprehensive healthcare network in the UAE. It was established back in 2007 with an objective of operating all public sector hospitals across the Emirate of Abu Dhabi. SEHA, since the beginning, is committed to delivering world-class healthcare services using the most advanced diagnostics and systems across its network. In the past, there were partnerships with Cleveland Clinic, Johns Hopkins, and lately with Mayo Clinic. SEHA is evolving in the sense that today we are owned by Abu Dhabi Holding Company, ADQ. We are operating in the Emirate of Abu Dhabi, but we are like any other healthcare providers in the Emirate of Abu Dhabi. We are following all the regulations of the Department of Health. SEHA operates a number of healthcare facilities as well as running academic residency programs and some research. We are partners with Khalifa University, UAE University, Fatma College for Nursing, Mohammed bin Zayed University of Artificial Intelligence, as well as Mayo Clinic. I will share with you just briefly 2 slides on our relationship with Mayo Clinic. A joint venture agreement was signed between SEHA and Mayo Clinic back in November 2019. The main purpose of that agreement is to improve the quality, efficiency, optimize patient outcomes and experience, facilitate life science research, private sector partnerships. We are going to introduce hub and spoke network centered at Sheikh Shakhbout Medical City, which is the latest addition to the healthcare facilities within SEHA network. The aim is to make SSMC a destination medical center. So in that destination medical center, it's going to be a tertiary, quaternary referral centers. We're expecting to see the most complicated cases. It is going to be a referral centers, and it will be positioned as the most advanced center for trauma, burns, and rehab in the broader region. SEHA is very simple and very clear. We focus on the culture of excellence, and you can apply this in every mile the patient journey is involved. So quality and safety, fair and just culture, entrepreneurial culture, innovation, as well as performance. We are, since we are the largest healthcare provider in the Emirate of Abu Dhabi and probably in the whole UAE, we sit on a tons of data that we are getting use of, and you can see how we are involving and making benefit of those data by introducing business intelligence systems, as well as surveys that are going to help us improve both our patient experience as well as looking after the well-being of our patients. This slide, I hope it shows very clearly. It gives you it summarizes SEHA in some few numbers. So we have a total of 13 hospitals. We have 4 dental centers. We have 2 ambulatory health services that provide pediatric general services as well as subspecialty for follow-ups. We do have 2 blood banks, and the rest is self-explanatory. Just briefly, I would like to share with you our COVID-19 experience. The first case of COVID-19 was diagnosed here in the UAE back on the 29th of January. But before that, our leaders have had a very straightforward, simple, strategic vision, which is to ensure safety to everyone who lives on the UAE. Having said that, the first thing our leaders have done was to unite both the private as well as the public sectors, especially in the healthcare industry. So we were united with all other healthcare providers. We have managed to increase our capacity. So within SEHA, we were able to create more than 10,000 beds in a very short time. We upskilled our physicians. We also increased our lab capacity in terms of performing tests. One of the strategies of the UAE government was to make testing available and easy. So we have managed to create more than 20 drive-through facilities, as well as more than 60 plus screening centers within the Emirate of Abu Dhabi and beyond. This slide actually is not the latest because the numbers keep changing. But as I said, we today have around 21 drive-through facilities, more than 11 camps for isolation, and that also includes some hotels. We have 3 large field hospitals with a capacity of 1,500 beds each. SEHA up to date have performed more than 4 million tests. This is within SEHA and in collaboration with the labs that belong to our network. As I said, safety was one of the main focuses of our leadership. So we ensured that our patients are safe. We dedicated some facilities to be COVID-free facilities. We looked after the well-being of our staff. Alhamdulillah, we never run out of PPEs. I cannot think of a single day that we run out of PPE, and that per se have played a major role that when we look after the number of deaths that happened within the healthcare providers, and we compare ourselves with other countries, we see that our numbers are very, very minimal. We also ensured that we do have a very standard, unified guidelines looking after COVID-19 patients, and that was disseminated through the whole country, and the government have made all the efforts to ensure that the latest medications were available for the patients. Just few words about the COVID-19 vaccination. As you probably know, phase 3 of the Sinopharm vaccine is also being entertained here within Abu Dhabi. We have recruited around 31,000 patients to participate in this phase 3. SEHA is playing a major role in the fact that we are working with the Department of Health and G42 to make this first-time experience a very successful one. As you probably know, the phase 3 trial is still ongoing, but what I can confidently share with you is that the preliminary results are very, very promising, and inshallah soon we will all celebrate and help humanity mitigate and fight this pandemic, and hopefully at the end of the day all of us will come out of it stronger and prepared for God forbids any future pandemics or endeavors. So that's it from my side. Thank you so much.
네, 발표 감사드립니다.
Thank you for your wonderful presentation. Next, I would like to invite Mr. Neil Clark, Acting Director of Healthcare Planning Sector of the OHAD, presenting on the overview of the healthcare market and the investment opportunities in the Abu Dhabi.
So good morning and good afternoon, everybody. My name is Neil Clark. I'm the Acting Director of the Healthcare Planning Sector at the Department of Health, Abu Dhabi. You've heard presentations from my colleagues at SEHA and Mubadala. who are providers of healthcare, large providers of healthcare services in Abu Dhabi. The Department of Health is the regulator of the healthcare services. The slide I'm showing you here just gives you an overview of the healthcare landscape in Abu Dhabi. And in fact, Emily will be pleased because you can see there a picture of Cleveland Clinic on the left-hand side. There are 6,025 beds in 61 hospitals in Abu Dhabi. Population just under 3 million. And the vast majority, 98% plus of the population, is insured, has health insurance. There's a growing population that we need to manage, and growing, therefore, expenditure in healthcare over the coming years is also identified on this slide. We also, in addition to the growing population in Abu Dhabi, intend to grow the health system by attracting international patients. And we expect that we'll be running towards 40,000 international patients. That was the plan for this year. I think COVID maybe has taken us slightly off track, but the plan is still to aim for 40,000 international patients. We have some of the largest names and some strong providers in Abu Dhabi, and we're excellently placed geographically to receive medical tourism from the MENA regions. We can see that the landscape, the healthcare landscape, has been growing significantly over the past few years, and we've increased from 3.9 beds per 1,000 population to 5.2 beds per 1,000 population. You can also see increasing numbers of physicians and nurses. And you'll also note that we've seen an increase in facilities, but predominantly in the private sector. So in 2016, probably the vast majority of the facilities were provided within the public sector. And moving forward now, the vast majority are provided within the private sector. So we've seen a big growth in the private sector. As the regulator, the Department of Health expects and treats both providers, be them public sector or private sector, the same. The standards, the expectations of the clinical care are exactly the same for both public and private providers, as are, in general, the payments to both providers. You can see there's a list of some names down there. We've got some big names here in Abu Dhabi. So it's a strong and attractive environment, the healthcare system in Abu Dhabi. We're a regional leader in the application of artificial intelligence. We've developed the world's first health information exchange system, one of the world's first health information exchange systems, with nearly all the facilities loading their electronic health records into a central database called the Malafi system. And I'll give a little bit more information on that. We've got 4 major universities in healthcare. We've got swift access to capital, and there are Mubadala here. There are a number, an Abu Dhabi Investment Office. There are a number of supporting entities which will support capital. We've got a strong competitive regulatory environment. We've got world-class facilities, Cleveland Clinic, Mayo Clinic, John Hopkins, Imperial College, Seoul University, King's College. Lots of experience in working with international partners, and experience in conducting phase 2, 3, 4, and 5 clinical trials in Abu Dhabi. SEHA mentioned some of the COVID challenges that we addressed, as a primary partner in doing that. SEHA did an excellent job, as did the rest of the providers, including Cleveland Clinic and Mubadala, in tackling our response to the COVID. We did come together as one emirate and work together, the regulator, the public sector, the private sector, and we did an excellent job in responding to the COVID. We saw a 200% increase in bed capacity within 8 weeks, and a 300% increase in ICU capacity. 10,000 isolation spaces were commissioned and 50,000 quarantine spaces. 100,000 digitally enabled home quarantine patients. So lots of activity was happening. 5 million tests, and I think we mentioned this before, Abu Dhabi has the highest global testing per capita than anywhere. significant numbers of tests, 22 licensed labs within 8 weeks of the emergency, with less than 24 hours turnaround time. So there was lots of response put into place from Abu Dhabi, supported by our colleagues in the provider arm to tackle COVID-19. And today, we still keep driving. There are still regular meetings of the leadership and the healthcare providers to tackle and maintain our response to COVID-19. The model of care that we have in Abu Dhabi just puts, as you'd imagine, the patient at the centre. So the patient's at the centre of everything we do. We want them to stay healthy. If they get ill, we want them to get better quickly. And we want to wrap around them whatever they need. So it's all about the patient's experience and how the health system wraps around the patient, as opposed to how the patient enters into a health system. The system needs to be accessible and equitable. It needs to be value-driven and sustainable. So we need to ensure that whatever we're building and developing as the Department of Health is sustainable. It needs to be collaborative and smart. We do a lot of work together with our providers, and the providers here will know that most of the work we do as the regulator, most of the standards that we bring into play are done with consultation and indeed with clinical leadership often from the providers. So we use our clinical experts to help us write those standards that we then apply to all the providers. The Centre for Health and Research and Innovation. So this is an exciting area that we're moving into to provide advisory for the investments and research area. So there's much work being done here now about how we build this Centre for Health and Research Innovation, identifying the governance and the stakeholders who will be involved, the regulation and the policy makers. And you can see at the bottom, we've got a number of people involved supporting this to move it forward. So we're very excited about how we're going to take forward research and innovation and create a true centre for health research and innovation in Abu Dhabi. In addition, and supporting is the Malafi system. So the Malafi system's got 1,969 out of 2,298 facilities signed up to join. This is going to connect all the different healthcare systems by the providers to capture information of all the clinical records into one place. This information will be extremely supportive to ensure that patients get the best services possible and that they don't have to get repeated tests. If they present at the emergency department, the clinical record is available to the emergency team. If they present to a different provider, the clinical record will transfer with them to that different provider. So from treating a patient, this will be a really forward-thinking way of managing them to the optimum. But in addition, it starts us to allow us then to use artificial intelligence to use this information to see different trends and what happens if a patient's treated one way compared to a patient treated another way. So the information will be vast, and this information will show the whole record for the patients in Abu Dhabi, for all the patients in Abu Dhabi. And if say all the providers are signing up for this, and there's a plan to have them all signed up for it in the very near future. And then we will start to work out how can we really make the maximum use of this information. And there's much exciting thoughts coming out, linking back to the research and innovation as to how this information is going to be really useful for us moving forward with how we manage the systems. So my final slide, we present world-class opportunities to meet demand across several distinct services and sectors within the region. So we spoke about the provision of services for regional needs, healthcare services, but there's also medical and nursing education. We have an aim to become a medical educational hub, and there's a piece of work being led by one of the teams at the Department of Health, supported by the key providers, to enable this and to attract students from around the MENA region to come and do training in Abu Dhabi, and working with partnerships with key stakeholders from outside Abu Dhabi to support the delivery of this medical and nursing training within the Abu Dhabi. We're moving into the wellness So the wellness industry we know is growing significantly, and how the wellness supports the health is a very important area for us to understand. We spoke about healthcare innovation and clinical research, and how we want to involve small, medium enterprises in the delivery of the healthcare system. So if I leave my slides there, the slides have been made available to everybody, and people can take the slides at their own leisure, and then we will happily take any questions at the Department of Health that anybody has for us. So thank you very much for your time.
네, 발표 감사드립니다.
Thank you for your wonderful presentation. Next, I'd like to invite Emirati Korean team Tekka and present on overview of the convergence of the Emirati and Korean culture.
우선 이 자리에 계신 모든 분들께 감사한 마음으로 인사드리겠습니다. 안녕하세요. 저희는 테카 회원 메이사와 알하누코라고 합니다. 테카는 다양한 문화 활동을 통해 에미레트와 한국 문화의 가교 역할을 하는 아부다비의 기반을 둔 동호회입니다.
아랍에미레트 한국 소교 40주년을 맞이한 것을 축하합니다. 오늘은 우리가 두 나라 사이에 몇 가지 비슷한 점에 대해 이야기하려고 합니다. 경제협력은 UAE와 한국의 전략적 동반자 관계에서 주목해야 할 부분 중 하나입니다. 통계에 따르면 UAE는 MENA 국가 중 대한민국의 가장 큰 무역 파트너입니다. 의료는 중요한 협력 분야 중에 하나로 특히 코로나 팬데믹 시기에 두 나라 간 더욱 강한 협력을 느낄 수 있습니다.
두 나라 모두 가족에 대한 존중 및 강한 유대감을 가지고 있습니다. 성인이 되어서도 부모와 함께 살거나 따로 살더라도 자주 방문합니다. 한국의 경우 보통 결혼 후에는 독립하여 따로 살지만 UAE는 아직까진 부모 혹은 부모 및 주부모와 함께 사는 것이 일반적입니다. 이 덕분에 주부모와 손주들의 관계가 매우 끈끈합니다. 하지만 UAE도 최근 들어서 공부 및 직장 등의 이유로 독립하여 사는 가정이 많아졌습니다.
존경은 한국 및 에미레트 사회에서 매우 기존이 여겨지는 것입니다. 한국은 나이대에 따라 존댓말 혹은 반말을 나눠 사용하며 연장자에 대한 존경을 표시합니다. 두 문화 모두 함께 모여 식사할 때 가장 연장자가 식사를 시작한 후에야 다른 사람들도 식사하기 시작할 수 있습니다.
에미레트와 한국 모두 손님 환대 및 대접 문화로 유명합니다. 손님을 맞이할 때 많은 존중을 표하며 매우 후하게 대접합니다. 아라빅 커피, 한국 음료, 과일, 간식, 적절한 자리, 손님이 편안하게 느낄 수 있도록 신경 씁니다.
두 나라 속담 중엔 의미가 비슷한 속담들이 많습니다. 대부분 연장자가 젊은 세대에게 지혜를 전달할 때 사용합니다. 예를 들면 아니 때 꼴뚜기 연기 날까, 그리고 꼬리가 길면 밟힌다. 또한 고슴도치도 제 새끼는 함함하다. 두 나라에 비슷한 속담이 많습니다.
이렇게 두 나라는 많은 유사성을 가지고 있습니다. 함께 발맞춰 나가면 서로가 더욱 가까워질 것이라 믿습니다. 더 나은 미래를 위해 앞으로도 함께 일할 수 있기를 바라봅니다.
저희 얘기는 여기까지입니다. 잘 들어주셔서 감사합니다.
네, 마지막으로 아부다비 상공회의소.
Now, last, we'd like to have a short briefing by Mr. Ho Jong from Abu Dhabi Chamber, IRO of Korea.
여러분 안녕하십니까? 저는 아부다비.
Morning, good afternoon, everyone. I am the Korean representative at the Korea office of ADCCI. I'm Jang Ho-gun, and we help the works of ADCCI so that Korean companies can make inroads to Abu Dhabi. That's the work we do. So today I'll give you a brief overview in Korean on what we do at our Korean office. The webinar that we're having today, we had many participants from Mubadala, SEHA, and DOH of Abu Dhabi. But ultimately, ADCCI and KITA took the lead to get this organized. So all the participants who are joining us virtually, I would like to take this opportunity to explain you what ADCCI does. ADCCI was first established in 1969. We have about 10,000 members. We have large companies, SMEs, various different companies as members. And our main work includes invigorating investment or having different delegations sent over, do economic research, market research, and facilitate all these approval process and prove the origin of manufacture. So we cooperate with various different work, such as KOTRA in Korea would be the work that we do at ADCCI. So it's the only economic institution that does all this work in Abu Dhabi. The Korean office was first opened in May 2015. And the vision of our office is to achieve Abu Dhabi's Economic Vision 2013 and to do so supporting the diversification of industries. So we would like to help Korean companies to make inroads to Abu Dhabi, but vice versa, also help all these UAE companies make inroads to the Korean market. And we are also explaining what the business environment of Abu Dhabi is like to the Korean companies. ADCCI and ADCCI Korean office does various things. As I mentioned before, we send delegations over to Abu Dhabi and Korea, and at Abu Dhabi, at oil, gas is very rich. So we have many different forums and events that are hosted, and we take part in that. And we also host various different seminars and forums related to energy. And individual companies of Abu Dhabi might look for Korean companies. And so we take the bridging matchmaking role so that these two companies can be connected. And also we host B2B explanation forums and also events where you can find different companies from these two different countries. Also, we help Korean companies with different information when they want to invest in Abu Dhabi or make inroads to Abu Dhabi. However, at the moment, due to COVID-19, face-to-face visit is impossible. It's restricted. So we are hosting various different online events, such as webinars, or with Kira, who is our strategic partner. We had 3 rounds of different events to help this online facilitation, and also working with Gangnam District office, we signed an MOU so that our medical companies in Korea can be connected and can network with Abu Dhabi buyers. So these things are going on online and virtually.
그래서 이런 업무 등에 대해서는 제가 이제
So all of this work that we do, I gave you a short introduction. Next year, if COVID continues to be a problem, I think we'll have to engage in various different activities online, virtually, so that Abu Dhabi and Korean companies can meet virtually, so that we can matchmake them, bridge them, and also provide information to the two parties. And if the situation gets better from the pandemic and we can visit one another, then we will help Korean companies to partake in events in Abu Dhabi so that they can showcase their products and services. So these will be the work that we'll do moving forward when things get better with COVID. I have to move to the next slide, please. So lastly, I would like to mention our partners of the Korean office. We have various different partners who we have signed MOU, most representatively KITA, also KOTRA, KCCI, Busan CCI, also Finance Investment Association, and GBSA. And this year, we partnered with GPS and also with Gangnam District. We signed MOUs with those organizations as well, and we'll work as strategic partners. Korean office of ADCCI is located in Trade Tower, Samsung region. You can see the phone number 6000-3391. And you can also see my personal email address at the very bottom. And through this webinar, I hope that the Korean companies can they might think that this webinar was not enough. So if you still have more questions or if you want to know more about Abu Dhabi, contact me personally. I will talk with ADCCI HQ and provide all the questions and answers to the questions that you may have. And lastly, many Korean companies are aware of Dubai when they think of, Middle East. But if I may add a little bit more as representing Abu Dhabi, Chamber of Commerce, Abu Dhabi is the capital of UAE. It makes up 60% of its income, and population-wise, geography-wise, we take more than 30% of UAE. So it's a very important city, and I'm sure you've heard a lot today through this webinar, and we'll be having sessions tomorrow where you can network with the buyers. So when it comes to healthcare, medicine, getting the approvals, authorizations, and requires the cooperation of the government. So the healthcare, medicine area, if you want to make inroads to UAE, I think it's best that you take a keen interest into Abu Dhabi and use that route to help your company make successfully inroads to UAE. And we at ADCCI and Korea office will provide you these services. So make use of us. Thank you.